Here, this is the agenda with me, Lasha Kingsley, in Douala, Cameroon. On today's edition of the program, we are receiving a revered man of God, author of many publications, with the latest being Public Health and Religion, developing a COVID-19 pandemic theology. Reverend Boge Paul Ngome talks to the agenda. Reverend Mbonge Paul Ngome, Merry Christmas and welcome to the agenda.
Same to you. Thank you, Mr. Lancer Kingsley. Thank you for having me on the agenda.
This is the very first time we're having you on this program. It is always incumbent on our invitees to tell the televiewers more about themselves before we dive into serious business.
Wow, I know very little about myself, but I will try. My name, as you've rightly called, Ngome Paul Mbwoge. I'm a pastor of the Presbyterian Church in Cameroon. I've been working with PCC for 11 years now, since 2009. Yeah. I hail from Mwambong in Kupe Mwaninguba Division, Southwest Region. I basically grew up in Kumba, attending JBHS Kumba, CAS Kumba, and I went to the University of Buea, and then I ended up at the Presbyterian Theological Seminary.
We interest our televiewers to know that you read business management in Buea. So right. What is this issue of becoming a pastor? The inspiration?
Well, like everybody says, it should be a call. It should be a call. It should be a call, because growing up, I never dreamt of becoming a pastor. And being at the seminary, going there just to test the study, I just found that that was the right place and that was the right career for me.
Let's now talk about your latest publication, of course, which is our interest today. We're talking about the book that you launched that was over the weekend, recently, last Saturday in Douala, the economic capital of Cameroon, where you are pastor. Can you tell us a little bit about the book, your inspiration? What inspired you to write this book?
Yes, as pastor in Presbyterian Church Bonamusadi, I witnessed the COVID-19 scare. When the COVID-19 scare was at its apex, I saw ministry being challenged. I saw our culture being challenged. I saw our identity as a people being challenged. And it occurred to me that COVID-19 cannot be ignored. And it occurred to me that we should start thinking on how to accommodate it side by side with what we are. Yeah. And so it inspired me to put down a little words so that I can share with the world.
Okay, Reverend, your book presents a good case for a holistic 3 pillars treatment, that's healing of COVID-19. Can you tell us more about these 3 pillars that you cited in your publication?
Yes, the publication says for us to have a holistic healing, man should not be regarded as a mere physical entity. We are blessed with the revelation to know that man was created to be spirit and material, and the soul of man is made up of the spiritual part and the physical part. It is written that God made man from the soil, and he breathed into man, and man became a living being. And so, looking at man's physical being in the perspective of health is not complete. And the book is putting forth some reasons why man should be regarded as a spiritual entity, not only as a physical entity health-wise.
Okay, Reverend, you equally raise this issue of religion or spirituality being ignored in the treatment protocol of COVID-19 as well as other diseases around the world, especially in Africa and Cameroon in particular. So can you throw more light on this spiritual religion aspects that you want health practitioners to incorporate into their protocol, treatment protocol?
Exactly. I think COVID came to bring that on light. COVID came to bring that on light. When COVID was at its apex, you could not visit a COVID patient. COVID patients were confined as though they were guinea pigs. And even the people who died of COVID, their corpses were treated as if they were not human beings. They were taken away from their family, and their family were not given the opportunity to pay the last respect as per the culture.
Yes.
And so I think COVID came up to bring the lacking part of our medical system that ignores man's spirituality. In as much as man is a spiritual being, man deserves some spiritual healing, spiritual assistance and comfort, and spiritual support.
Yes.
in crisis, especially in health crisis.
You equally cited in one of the chapters of the book, which I cannot actually lay hands, though I've flipped through the pages of the book right now. You said that you raised this issue of, in the book, you said logically and realistically, you bring in the spiritual elements as justified by the components of human beings created by God. You equally said that you went further to explain that any attempt to treat an unhealthy body while ignoring the spiritual implications will fail.
Yes.
We've seen some pastors and men of God who have died while they were visiting the center, COVID-19 center. Can you reconcile this line in your book to the realities of the COVID-19?
Exactly. Now, Mr. Kingsley, I am not an extremist.
Yes.
Yeah, I'm not saying that well, pastors should not be cautioned or should not take care of themselves as caregivers, just as medical doctors do when addressing the needs of such patients. So, in as much as medical doctors do attend to the needs of such patients, it means pastors or spiritual leaders of those patients should be given the opportunity to administer to them also what they need. So I am somebody who consider COVID-19 as a very contagious disease.
Yeah, I will be coming to that.
Yes,
I have a question concerning
exactly.
that. Yeah.
Medically, we recognize the medical protocol, but shutting a human being down completely as though the human being is not a spiritual entity is what I'm speaking about.
So the spiritual aspect you are talking about, the component, means that pastor, they have to pray while medical doctors administer whatever treatment.
Exactly.
They have
Or
to pray for them.
If a Christian or somebody who believes in God requests for prayers or requests to see a man of God, the doctor should not refuse that request. Instead, the doctor should see how to help.
Provided the guidelines given by the government of Cameroon as well as the World Health Organization is respected.
Exactly.
Okay.
Exactly.
All right. You equally talked about this myth surrounding the disease. Many people are still to come to terms that the coronavirus pandemic is real. Even after the second phase, that is, we are seeing the way it is ravaging some countries in Africa as well as the world. People don't still believe that COVID-19 exists. You raised that issue in one of the chapters of your book, which I have in front of me here, where you caution people and you told people about the realities of COVID-19?
Yeah, I think basically there are 4 reasons why this publication is out. First, for awareness sake, to say
Yes.
COVID-19 is a disease and to talk about it. Secondly, this book was put in place to clarify misguided information, which you are now talking about.
Yes.
There have been some conspiracy theories, some lies, some thinking about the disease. This book goes away to clear all those doubts about the disease.
You have some people saying that the COVID-19 that we have in Europe and America is not the same COVID-19 that we have in Cameroon. Some people think that we have but a fabricated COVID-19 in Cameroon.
Well, it can be true. It can be true because last week I spoke with Professor Nchinda, a veteran professor in epidemiology. He said some of his students in it should be Mali are discovering a new strand of the disease there, which means maybe the genetic makeup of that disease there is quite different with it elsewhere, and maybe since the research is ongoing, we keep our ears on ground to listen to new findings.
So what
ideas.
actually have you told people, because you equally talk about African treatment, the lifestyle, the way we have to handle the disease you talked about? Can you throw more light on how Africans, they have to handle the disease? Because we talked about herbs and some other stuff that have to be administered alongside the conventional medicine.
Yes, I believe very strongly that before the coming of the white man, we had great empires. We hear of the empires of the Western Sudan. We had great empires in Africa, and I believe they had a good health system in those days. But unfortunately, since we don't have a documented culture, such informations were never handed to us.
Okay.
So I know as a people we had a way of treating illnesses as Africans before the coming of Western scientific medicine. We had a way of treating ourselves, and we should not ignore that. We should never ignore that. And even till today, there are some illness that our African brothers believe, even if they go to the hospital, they believe that they can only be healed traditionally, like typhoid.
Yes.
They know that if they take country medicine, is better than to take chemicals in the hospital.
We equally have some doctors in Cameroon, traditional, let me not call it traditional doctors, herbalists.
Yes.
They've come up with the COVID-19
exactly
medicine.
Yes,
even Samuel Kleda.
Actually we researched on the Madagascar COVID organic, which was actually healing people testified, and even Kleda's essential oil.
Yes.
Essential oil, people were using it and they were getting healed, and you cannot ignore that fact. But the medicines or science will always give you a protocol or a test to pass in order that for that medicine to be acknowledged that it can cure this or that.
There has been a lot of laxity when it comes to, the COVID-19 barriers, implementation of these COVID barriers measure. I want you to elaborate once again on this. I want you to tell the population, you've done a lot of research before writing this book about COVID-19. What do you have to tell them about some of the barriers measures that has been put in place by the government of Cameroon?
They are very important, and we should consider them, because apart from COVID-19, kata.
Yes.
Kata. If you have kata, you won't want your children to have kata, or your wife to have kata, and you can have kata and you take measures so that it is not spread in the household. And it is the same principle. It's the same principle. So if you love your family, you should be able to be mature enough to observe the measures put in place so that you should not
harm your family, your
others.
society.
Yeah, you should not infect others. So the truth about our health is that we should be responsible enough to take care of the people around us and to behave maturely. So washing of hands in itself, a universal rule that comes to enhance our health. And putting on masks also helps to protect people around you, not only yourself, people around you. Not shaking your hands and things like that are all necessary, and going into public space without masks is also to be very much considered.
Okay, Reverend, the coronavirus took all of us by surprise, and the government took certain measures which restricted the number of worshippers in church. You happen to be a pastor with the Presbyterian Church. So how is the church faring? How have you been managing the number of the number of worshippers in your church with these various measures?
Yes, Mr. Kingsley, thank God the numbers are going down. When the numbers were going up, everybody was afraid and frightened, but we did not shut down our church because of COVID-19. We respected the government measures. We never took up to 50 persons in a very large church of a capacity of about 2,000. The distance was there. So what we did was to multiply the number of services.
Yes.
And the length of services was short. So I remember in those, in around May, April, June, we were having about 6-7 services a day. And that's how we implemented in our own way the government's strategy to fight. And I think it helped us. We had washing facilities outside the doors of the church. We had sanitizers at the corners to be used by everybody. And we asked every Christian to come to service with a mask. Those who could not afford a mask, some Christians were generous enough to offer the masks.
Reverend, in chapter 2 of your book, you talk about origin and discovery of COVID-19. Many people don't actually know what COVID-19 is all about. COVID-19, whatever.
Yeah, it's right. Even the abbreviation COVID-19 simply means Corona Virus Disease 2019.
Yes.
Yeah, and it was named after a series of analysis by the WHO taxonomy department, and it's actually a disease that came into being when the novel coronavirus was introduced into the human system. And history says that it was at Wuhan in
that
China.
It was fabricated
in China.
We had the U.S. president, current U.S. president, keep referring to it as Chinese virus.
Exactly, because it was first reported there and it was first discovered there. Who knows? Maybe since it was easily spread, it might have come from elsewhere into Wuhan. Who knows? But we know that coronaviruses have existed since 1930. So this was a new family of the virus being introduced into the human system.
Though when you compare the first quarters of 2020 with this one now, with where we are now, when you compare how people are receiving or people are behaving vis-a-vis the disease, what do you have to say? Has much changed about the way of lives, the way we live, the way we do things in the church?
I think it's more dangerous now. It's more dangerous now because people just think coronavirus is not something for us. We were deceived, right? Because the impact did not actually touch us that much.
Probably because of our genetics. Or
Exactly. But we should be cautioned and we should be more careful because it might come back and it might affect us. The wave coming might come back and affect us grievously. So I think we should know about the disease first, and that is the intention of the book. If we know about
many
the
people
disease,
watching at us now, where can they get a copy of your book so that they will be able to read through, know what is the coronavirus is all about, how to prevent themselves, the myth surrounding coronavirus, as many still believe that the disease is a Chinese disease fabricated in China and has got absolutely nothing to do with us in Africa?
we can have a copy of this book for now at the Presbyterian Church Bonamusadi, the pastor's secretariat. You have a copy of this book, but we intend putting it at the press book shops all over the country, press book shop, and we are also in the process on putting it on very famous bookshelves in the world, like Amazon bookshelf. We're in the process of putting it.
The last message probably about Christmas to many flops or worshippers who are listening or watching at you right now. We're talking about the Presbyterian Church, worshippers of Presbyterian Church.
Wow. I will be happy to know that they are listening to us right now, and being a pastor of that church, I love them so much. And I want to tell them to be aware of coronavirus, and that if we know what the virus or what the disease is all about, we know what to believe about the disease, we can easily handle the disease as a people, as individuals, without necessarily scare or panic or confusion.
Reverend, I must confess that the book is very rich, because I read through the book, and those who are within the corridors of power might likely be interested in your publication and might want to get the books to the citizen, the common man, probably in all the nooks and crannies of Cameroon. What do you have to tell the officials of this country about this beautiful work that you've done?
This publication is done for the public. It is written in simple English that a secondary school child can read, and even an expert or a technician also can read and understand. So having a copy of this book is very, very important for the fight against COVID-19. So it can be purchased by any person. It can be used by any person. Even schools can use it. Parents can buy it for their children, and they themselves should know what
I must confess, this is the
about.
first publication about coronavirus in Cameroon, if I get my facts correctly. I think in English.
Maybe.
If I get my facts correctly.
Maybe that is being advertised now. Maybe there have been others we don't know about. But we are struggling to advertise it so that people know about it, and that makes it maybe first.
Okay. Reverend Bongel, thank you so much for being a part of this edition of The Agenda. Merry Christmas once again, and thank you so much for accepting to be part of this edition of the program.
Thank you very much, Mr. Lancer Kingsley. Thank you for having me on The Agenda on my Media Prime. God bless you and your crew.
Thank you, Reverend.
Thank you.